I'm John Bilodeau, and I would like to preview a case report in this month's journal of the AJODO. The patient is a 58-year-old, 8-month man who was referred to the orthodontist for prosthetic restoration. The facial photographs demonstrate a slight Class 3 facial profile, with a maxillary midline off to his left. His teeth were stained and very dark in appearance. The dental casts exhibit an angles Class 1 occlusion. The maxillary left lateral incisor is missing. The maxillary left canine is in the lateral position. There's a 3 mm space between the canine and left first premolar. The mandibular left third molar is present, as are the mandibular third molars. There is 6 mm of lower anterior crowding. The mandibular right first premolar is missing. The mandibular left lateral incisor and left first premolar are in buccal crossbite. The panoramic radiograph reveals the maxillary left lateral is missing and the maxillary left canine is in its place. The maxillary right and first and second premolars are osseointegrated implants with crowns. The maxillary right third molar is missing. The cephalogram and its tracing show a slight Class 3 tendency. The anterior and vertical facial height are normal. The mandibular incisors are slightly procumbent. There is minimal overbite, and the profile is straight. There were two treatment alternatives. The first, trephine and remove the maxillary right first premolar implant and use implant anchorage to move the maxillary incisors to the right to make room for a right lateral incisor osseointegrated implant. Close the space between the maxillary left canine and left first premolar and close the mandibular first premolar space. Move the mandibular midline to the right to resolve the crowding. Prosthetically restore all maxillary and mandibular teeth, creating anterior and incisal guidance. 2. Second option. Extract the mandibular left central incisor. Accept the maxillary midline position. Use the implant crowns as anchorage to move the left buccal segments forward. Maintain the lower first premolar space for an osseointegrated implant and crown. Restore all maxillary and mandibular anterior teeth. The maxillary left canine would be restored as a lateral incisor, but would still function as a canine with the mandibular left canine to provide proper disclusion with the left buccal segments and lateral excursions. Here is a preview of the final results. Click on the link below to see the full treatment report in the September issue of the AJODO. Thank you.